anything. And
So we've got 174 people in here, Anne Marie. So we're going to have a conversation with her. We're going to first start out with talking about what medication she's on, what dose she's on, how much she's lost, and we'll go into that a little bit further. So we're going to say that, Anne Marie, and then we're going to talk. We'll go back to the beginnings of life, and we'll have a conversation. So go ahead and tell us what you're on.
it sounds good. So my name's Anne Marie. I've been on Manjaro/Zepbound since 2022. I'm currently on 10 milligrams. And yeah, I mean, it's absolutely changed my life.
Yeah. So let's go back to the beginning, Anne Marie. From the earliest part of your life that you can remember, what was your struggles like? When did you realize kind of you had, and we'll get into this, guys. She deals with multiple chronic illnesses, and we'll get into this. But when it's talking about this disease of obesity, when did you kind of start seeing this?
My earliest memory of like it being an issue was I remember being bullied in first grade for being the biggest kid in the class. I was the tallest kid. I was also so I was the biggest kid, both height and weight wise. I was also the smartest kid in the class, so I had all of this going against me. Like, kids are brutal, man.
Yeah.
So they did not appreciate that I was smarter than them, that I was taller than them, and then my weight was very obviously different than all of my classmates, and they used that as another point of bullying and like exclusion and being
Yeah.
just
That's
being
hard.
kids. Like, I mean,
Yeah.
I don't think 6 and 7 year olds really understand how mean the words that come out of their mouth can be.
Yeah.
So, but I mean, that's one of my earliest memories of being in school, was being bullied for the size of my body.
Yeah.
which
So
was-
how'd that make you feel? Like at that time, did you have feelings that you can remember of feeling like, what's wrong with me? Like, why can't I get this figured out? Or what were your thoughts?
Yeah, so I remember that like my parents were very like, well, you're still growing, like it's still just your baby, like it's still just baby FAT, like it's gonna, the more you grow, the taller you get, like it's gonna kind of level out and be fair,
Mm-hmm.
and be like even. And then I just remember that it didn't. I would grow and it would kind of level out for a little bit, and it would make the bullying stop, and then I would gain a bunch of LBs again, and it was just kind of this vicious cycle. And I just remember I was probably in third grade where I remember being like, my body looks drastically different than my classmates'
Mm-hmm.
bodies. And then I remember being in fifth grade and having to shop in the women's section for clothes. Like, I didn't have the same experience that everybody my age did, where like you got to shop in the junior section, you got to wear all the cute clothes.
Yeah.
Like, my mom did a great job though of making sure that like the clothes I was wearing were like very neutral, and you couldn't really tell that they were from the women's section. Like, it was just a lot of like solid color tops and solid bottoms.
Yeah. So when you were feeling that way, did you feel like your friends, maybe your friend group treated you different, or did you not have to, like you couldn't just go shopping with them? And
Yeah, like I remember, so my childhood best friend, who is still one of my best friends to this day, she's always just been in a naturally thin body. But I remember like when we would go to the mall to do like back to school shopping or just like hang out, that like I would go and look at all the cute things in like Hollister or Abercrombie and Fitch and be really jealous that like she could just buy something off of the rack that fit at those stores. And like I was shopping at stores like Kohl's and JC Penney's and
Right.
like the clearance section at Dillard's. Like, we just had very drastically different experiences. So I was probably 11 or 12, like the first time I really realized that like, holy cow, my body is not doing the things. But it also was like, I grew up in a time where like we had to do the presidential fitness test in PE, and
The worst.
like, why do I have to run? What does me running a mile have to do with anything?
Or climbing the rope.
Oh my God. Like, you have to do 10 pull-ups. Like, no.
Yeah.
No.
I would be purposely sick that day. I wouldn't even
Yeah.
attempt it.
I knew it was coming, and like I would like once I was old enough to like make that decision and like talk to my parents about it, be like, I'm not going to school. Like, not doing it.
Did you find that you with like your girlfriends or whatever, like just living life and hanging out together, like you physically just couldn't do this similar things? Or I don't know, like for me, like all my friends were like doing cartwheels and just goofy things, just hanging out. And I'm like, I could never even possibly.
Yeah, like the idea of doing a cartwheel was mortifying because I was like, I'm going to absolutely face plant it, and like I was like, me and gravity are not friends on a good
Same.
on a good day. Like I don't need any help in that department. But I had several friends that were in gymnastics, and I mean, I was an active child. Like I did dance 3 times a week. I did competitive swimming in high school. I played volleyball in middle school. Like I was always very active. So then like when again like that realization that like, hey, I'm doing all the things that like this, and like it doesn't matter. Like I think like I was talking to Gianna about this yesterday actually, because we were restarting my
and Gianna's her dietitian.
Gianna's my dietitian. She's fantastic. She specializes in chronic illness, GLP-1s. Like she's amazing. But we were talking, and she was like, where do you think you would like to land, kind of like if you like could be any size? I was like, I don't remember. The last time I remember being in like the 140s, I was 13 in 8th grade.
Yeah.
Like, I don't know what my adult body feels like.
I feel like most of us are similar to that for sure.
At 140. So I was like, and we all know that like the BMI chart isn't the greatest and it has its issues, but like it is helpful to kind of have like a framework for me of like, okay.
Yeah.
To really like to be in a healthy like range, I should probably be somewhere between 135, 145. Sure. So I told Gianna I was like probably somewhere in that 10-pound range, and I was like, obviously the closer we get, like the more I'm willing to like kind of fine tune that. But it's like I don't know what my adult body feels like at that size.
Yeah. So going back to being a child, teenager, tween, whatever, did you find yourself doing things to help yourself out with dieting? Like, what were your early experiences with trying to do something like that?
My first like diet experience was at 13, which is also kind of reassuring. Like the longer I've been in this community and the more I've been like, okay, like this is not like just like my experience. Like we all kind of had very similar teenagers. Mm-hmm. And all of that kind of thing. I remember that I started skipping meals. Mm-hmm. Like I would eat breakfast. I would pick on something at lunch at school. And then I would go I would pick on something at lunch at school, and then I would eat dinner when I got home. But then I remember being very like, I need all of these veggies, and I need to eat salads, and I need to do like these very low cal options to, and which the fact that was my mentality at 13 should have been like the hugest red flag to any and everybody.
Yeah. What was your parents saying to you this way? Or was this a thing like back and forth with you guys, or is just this you in secret like trying to figure this out? Or?
My parents both have struggled with obesity as well, so it's very genetic in my family. But Oh my God. And 100-calorie packs. Jay, I lived off of like the 100-calorie Oreo
Yeah.
packs.
Right. I'm going to take 700 of those 100-calorie Oreo packs,
I'm
bitch.
going to have 3 of these for a snack and we're going to be good, right? Okay.
Yeah.
Like, oh my God. Like, whole, like,
Yeah.
actually saw the 100-calorie packs the other day. I was buying snacks for my nephew and I was like, absolutely not. Like, we're just walking right by that.
Yeah.
But my parents struggled with their weight too. So we did, I mean, we've done South Beach diet in my house. We've done Atkins. We've done the we did Slim Fast. We did what else did we do? My mom did Optavia for a while. Like we've just done like
Yeah. It was
I
hard. And how did
remember
you do? How did it go through all of those?
um I never noticed a difference, but it's hard, right, when you don't have 100% control
Yeah.
of your food intake and all of that. And like, thankfully, I never grew up in a calorie counting household because that would have been
Yeah.
detrimental for me at 13. It wasn't any better for me at 16, if we're going to be honest, but at least my parents spared me that. Like,
Yeah. Well, and they have the disease. I mean, maybe at this time, obviously didn't know this was a disease, a chronic,
yeah.
thing for you guys. But so how was the dynamic? It seemed like they were pretty helpful.
Yeah, so we would like do it as a family. Like when my mom cooked, like it would be whatever diet of the week. I used to call it the diet of the week in our house. Like it was whatever new thing my mom saw on the Today Show that we were trying out for 2 or 3 weeks.
Yeah.
That might or might not work. I didn't mind. Like of all of the ones that we did, South Beach was the least offensive to me. We did have a very short-lived WW phase in the house, and that was miserable. Like having to
Oh, yeah.
count out every individual cracker I was going to eat or every individual, like, I remember, I think it was like you could have 4 pieces of lettuce, 4 lettuce leaves, and it was no points. But if you had 5, then it was 2 points. And I was like,
Yeah. So, it's interesting, like with your family dynamic, you guys all kind of were doing this together. Was this something that you guys thought about, like, as far as like, this is just life in this family? Or is it like you knew exactly what you were doing differently than other people around you?
I knew that it was different than what my friends were experiencing, but it was also just very normal to me that like my mom watches the Today Show before we go to school and sees this like new.
Yeah.
It was also when Dr. Oz was really grabbing a foothold in like the media space, and like his whole thing was like absolutely no fat at all. So we did an era in my house where everything was fat free, and fat free ranch should be outlawed and illegal. And like,
right.
I'm like now in my adult life, I'm like, I will just take the calorie hit. Thank you. Like, it's not worth.
So we'll start to intertwine other chronic illnesses in this point, but tell me what, as a teenager, what are your next steps? Like what happens in your life going on?
So I also remember I had very painful and very dysregulated menstrual cycles. Like I started my cycle at 12, and then by 13, I was like, I am so uncomfortable. Like my periods were excruciating. I was starting to have to miss 1 to 2 days of school because the first 2 days of my period just knocked me out. So I remember we went to see the gynecologist who delivered me and my sister. So he's been practicing gynecology longer than like the dinosaurs have roamed the earth at this point.
Okay.
And his answer was, well, some girls just have really painful periods, which becomes a really weird running theme in my life from about 13 to about 18, where every time I complained about something and went to the doctor about it, it was, well, that's normal for teenage girls.
Hmm. Shame.
Like the first time my knee dislocated at 13, the orthopedic surgeon I saw was like, oh, that's normal. All girls dislocate their knees at 13. I was like, I don't think so, but
So what did you think? So you're thinking, okay, well that sounds weird, but then you went on with life thinking, okay, right? This is, I
yeah,
guess, normal.
yeah, and it's one of those things where like my parents also didn't have very high healthcare literacy. We
Hmm.
lived in a small town. Um, so healthcare was kind of health, and it's still this way in my hometown. Like healthcare is just not great.
Mm.
There, it's a small town. We have a high turnover of physicians. We have a lot of mid-levels, like NPs and PAs providing specialty services that I don't think they are necessarily qualified to be providing. But in a small town, it's like, what are you gonna do about it?
Right.
So my parents were very much, well, if the doctor said it's fine, then it's fine.
Hmm.
Like there was very much that kind of mentality in my house. So I was complaining about how bad my periods were. Somehow, at some point, we ended up seeing a family nurse practitioner for primary care. And I was complaining to her about how bad my periods were. And her suggestion was that I go on the Depo-Provera shot.
Hmm.
At 16, not knowing any better,
Yeah.
okay, didn't help anything, made the WT bump up exponentially.
Sure.
It's also a really painful shot. I remember not having a great time every time I was going to get it. I was like, this is not the best. And then she started me on my first like super restrictive cal deficit at 16, where like I was having to weigh out food. I was having to count calories. I was having to eat no more. I think I was, yeah, it was my first experience with a 1,200 calorie a day diet. And
Hmm.
like putting a 16-year-old on that kind of calorie restriction is
Yeah.
diabolical in hindsight.
So I know this is going to progress and we're going to talk about it more, but what are you thinking right now in your little adult life at 16 years old with the weight gain and then all this knee,
Yeah.
with dislocation and all these other things that are happening to you with the periods? What are you thinking about yourself right now?
Well, this is still, so I was 16 in 2007. So this is the peak of it's a willpower issue. It's you're not trying hard enough. It's if you want to look as pretty as all of these celebrities, like just skip meals,
Yeah.
like it was like, that was a rough time to be a teenager.
Well, and what are you thinking? Because you're desperate.
Yeah, so I was like, okay, so the only way I could figure out to not be completely miserable and that low of a calorie intake while I was competitively swimming, by the way.
Oh, which, I mean, hello.
Yeah, like I was spending
Talk about a full body workout.
yeah, my practices would start at 4:30 and go until 6:30. Like
In the morning.
yeah, we would do 2 a day, so we would do in the morning and then after school.
Yeah.
So it was diabolical.
Yeah.
I was also doing student athletic training at the time. So I was doing all of these things. Like I was doing all of these like high level activities. I was out in the heat a lot because I lived in the Southwest.
Sure.
In football season it runs August to November, and it's still 100 degrees in August. It's still hot in September. It doesn't really start to cool off until about my birthday in mid-October. So I'm like expending all of these calories and I'm not bringing in enough. So I would just come home at the end of my day, be exhausted, and have to go take a nap and then get up and do homework and then go right back to bed.
Oh
So I could be up for 2 a days.
Right. How awful.
It was, and I remember telling my mom, I was like, I just don't feel good. Like, I don't feel like I'm consuming enough. And my mom was like, well, the doctor knows what's best for you, so you should just stick with it and see what happens. Okay, thanks.
Yeah.
There was a lot of that in my, like, unintentionally, my parents wound up being very gaslighty about my experience in my body. Like in 8th grade, I was in my theater class and we were making costumes and I slipped and landed on my ankle, fractured my ankle. My dad made me walk on it for 2 weeks before he let me go see the ortho to get it looked at.
Was it because he just was cheap and didn't want to pay for it? Or did he
No,
just
he
think you
thought I
needed to
was-
walk
he-
it off?
Yeah, I was very my dad is former law enforcement, former military, like, so it was very much a rub some dirt on it and walk it off, you're fine.
Mm-hmm.
Like, you're not dead, dying, you're bleeding, you're good.
Yeah.
So, I learned like, that just started reinforcing that, like, I don't know what I'm experiencing in my body.
Mm-hmm.
Because every time I complain about something, I get told it's either normal for teenage girls
Mm-hmm.
or to walk it off and rub some dirt on it or to just deal with it if I want to be thin like the rest of my friends.
Yeah. So how did it make you feel?
I just remember feeling very isolated and very alone. Amidst all of this, my dad has gotten critically sick.
Mm-hmm.
And we've been dealing with all of that trauma. And being the oldest child, I've now been parentified and I'm in charge of making sure that my sister is, getting to school because I'm driving at this point. And all of these extra things that nobody in their teenage years should be having to be responsible for.
Mm-hmm.
I was having to cook dinner like 2 days a week because my mom was a teacher and would have to come home and grade or write IEPs or do extra work from home because my dad needed to be supervised a lot of the time because we still didn't know what exactly was going on. My parents left to come out to Scottsdale on my 13th birthday so my dad could come to the Mayo Clinic so they could try to figure out what was going on. And I was devastated that my parents weren't going to be there for such a major milestone.
Mm-hmm.
My mom did an amazing job, still made sure it was really special, had a lot of like fun things planned for me throughout the day. And my mom truly has done the best she could with what she knew and what we had. But I just remembered feeling very, very isolated very, very quickly. And like feeling just also that I was out of control because it seems like it didn't matter what I did. The entirety, like my body was betraying me. My body was doing whatever it wanted, regardless of what I was doing to try to control things.
Right. That's a lot. You are a fighter, friend. Holy moly.
Yeah, so which at 16 is kind of a diabolical experience to be dealing with. And then
did
we're
you
still in the
feel
early
like
2000s, so we don't believe in therapy or mental health resources or...
So did you feel like at that time, did you have resentment, like almost feeling like you weren't able to live your teenage life like your friends were? You know what I mean?
Yeah, I feel like I missed out on a lot. Like my grandma made my junior and senior prom dresses because I knew it was the only way I could have something that I liked that fit the kind of fashion, like the strapless tops and the like really kind of tighter corsets. I knew that if my grandma handmade it for me, it was the only way I would be able to experience that.
Mm-hmm.
So my grandma came, like when she came out for Christmas, 2 years before my junior and senior prom, she made my prom dresses for me, like, which was really special. And I'm really fortunate that like I was able to have that. But this is also the same grandma who at 13, when she was making my winter ball dress for me, stood in the kitchen and said, "This would be so much easier if you weren't so FAT."
Yeah. Can we just not have as much fabric, please?
Yeah, like this would be so much easier to do if you weren't. And I was like, I'm sorry? So just like, it seems like the size of my body was an issue for everybody, regardless of what I was doing, regardless of how I was trying to control things. Going to the doctor was always, well, you should try to lose it. You should, try harder. And I remember telling my pediatrician, I was like, if I try harder, I don't know how to try harder, because if I continue to down, I was like, I already don't feel good at this level of consumption. Like, can I add some more? And I remember asking, I was like, can I please add some more cows in? And he was like, well, why would you think adding more in would help when at 1200 you're not dropping anything?
That's so unfortunate.
And I was like, sorry I asked.
Oh, yeah, Anne Marie, that's hard. So you're dealing with all this now. You don't really know that you have anything diagnosable yet. Like you don't know anything quite yet what's going on with you, right? You just think it's just not trying hard enough. And that's the thing, man. People who in the chat, I mean, we can relate to this. I mean, we try, and people think we're just not doing anything. We're sitting on the couch eating bonbons, right?
Like I would probably have felt better if I was sitting on the couch eating bonbons.
Yeah.
Like, let's be real. The cows from that probably would have made me feel better. My brain probably would have worked a little bit better than it currently was.
Mm-hmm. Yeah.
I got my first diagnosis came at 16. I had a 2.5 week migraine, which we didn't know was a migraine at the time. I just had a throbbing headache. And every time I would go outside, I would go to school with the bright fluorescent lights. Like, it just made it worse. Everybody was too loud. The only time I was comfortable was if I was in my bedroom with blackout curtains, completely dark, not moving. Oh, so I remember that. And I remember one morning I was getting ready to go to school, and I was driving myself to school at this point. I had my provisional license, which I thought was the bee's knees. Okay. It was so bad that my parents had talked to the school and had gotten permission for me to wear sunglasses during the school day because I was just miserable. So I I'm driving my dad's 89 F-150 as my first car. Okay. I go to get in the truck to leave to go to school, and I put my hand on the steering wheel. And I know that my hand is on the steering wheel, but I can't feel my hand on the steering wheel. Like, it's like I'm looking at my hand, or like I know it's on the steering wheel, but I can't feel it. And I go, that's not supposed to be like that.
Right.
So I go back inside. My dad's not driving at this point because of all of his health issues. Go inside and I tell my dad, I go, my left arm feels like there's a bunch of pins and needles in it, and I can't feel the steering wheel like when I go to grasp it. And he's like, well, clearly you're not going to school. He's like, my dad like knew enough, like health-wise, that he was like, something's going on. We need to take you into the emergency room. Right. My mom's at work already. So my dad calls my confirmation, who ends up being my confirmation sponsor and my sister's godparents, and it's like, hey, can one of you guys come pick us up and drop us off at the ER? Anne Marie needs to go in. Spent all day in the ER, had all kinds of tests, lab work, CT scan. It was my first CT scan, and I having to, thank God it was a CT scan and not an MRI, because I had to lay there still, but everything was just so loud, and they didn't want to give me any meds until they got the CT scan, so they knew what they were dealing with, yada yada. CT scan looks fine. The ER doctor comes in and he goes, I'm 95% sure this is just a migraine that you've been dealing with. We're going to load you up with a bunch of medications. I'm going to send in a bunch of scripts. I've already called the local neurologist who handles migraines. He wants to see you in the office first thing tomorrow. Cool. Awesome. So I go home, we go home, I sleep off the rest of that. I slept for probably 12 hours because it was the first time my head didn't hurt in like 2.5 weeks. Went and saw the neurologist, got started on a bunch of like a bunch of medications, like a triptan for abortives, propranolol, which is notorious for causing WT gain because of its mechanism of action. And I was like, cool. So we're fixing one thing, but making this thing worse. Yeah. Yep. Awesome. At that point, I didn't care because I was like, I cannot function with my head hurting like this. Yeah. That's fine. Whatever. We're going to deal with it. Started that, finally started to get some relief from the migraines, was still averaging like 20 migraine days a month through high school, which was excruciating. Going outside. Oh yeah. Okay. It was awful. And I remember just being miserable. Got diagnosed with that, got diagnosed with hypertension at 20 years old. Got diagnosed with anxiety and depression at 21. Just started really kind of accumulating all of these like random diagnoses. Well, nobody was putting together that like, hey, maybe the migraines and the knee dislocations and all of these other kind of weird things she's got going on are related. So it wasn't until I graduated college in 2016, moved to Tucson, and started seeing doctors at the University Medical Center out here that we really kind of started digging into more things, doing labs. I remember had my first lipid panel at 26 when I moved out here. It was diabolical. Like it was just
Like what?
It was just off the charts. Like I think my triglycerides were like 250, 300. Like I just remember like everything came back red. And I was like, oh no. Like my dad's already had open heart surgery at this point. My dad's already had 3 or 4 cardiac stents placed. Like I was like, oh, like I knew enough to know that like, no. Well, come to find out that's genetic.
Yeah.
That all kind of runs in the family. So then like that Venn diagram was a circle.
Do you think, I mean, I don't want to stop you here, but like going back, you're like, okay, at 26 years old, like, don't you wish you kind of would have put that together? Not you per se, but just in general with family genetics and things, like, you know,
Yeah,
10 years
like,
earlier.
Yeah. And so it's 20, so I moved out here. I didn't really start establishing medical care, like complaining about things to my doctor until 2018 when I started seeing a resident for primary care. And then I was like, okay, here's what's going on. Here's what I'm concerned about. Here's what we need to figure out. My blood pressure is still off the chart, which come to find out is hereditary in my family. Yeah. My migraines are controlled, so I'm not needing treatment for that. But now I'm complaining that every time I stand up, I feel like I'm going to pass out and see Jesus. I don't tolerate the heat as well as I used to. Like I'm stacking all of these weird symptoms. And once again, I'm told, well, you'll feel better if you just lose the weight. Mm-hmm. You'll feel better if XYZ. Mm-hmm. It was always well, there's not much we can do until you start losing the weight. Yeah. So
you say, what do you say to that?
And I remember I looked at my primary care provider at that point and I was like, I've been trying to lose the weight since I was 16. Like if losing the weight was going to fix everything, surely it would have by now. And I mean, and I've yo-yoed at this point. Like I've lost 30, I've gained 40. I've lost 40, I've gained 60. Like I've just been kind of doing the whole yo-yo
of course
thing, as we've all done. And I remember sitting in my PCP's office and I am just miserable. I've been in and out of the ER because my heart rate's been so high. I just haven't felt good. And nobody's taking me seriously. And we keep reducing it to, well, if you lose weight, your blood pressure will be better. If you lose weight, you'll feel better. If you lose weight, your heart rate will be better.
Sure.
Yada, yada.
Yeah.
Sure. Like at this point, I'm like, sure, my weight is probably contributing to some of these things in some shape, size, or form.
Yeah.
However, it cannot be the solitary issue. I've now gotten a 4-year degree in healthcare, so I could learn anatomy, physiology, so that I could try to figure out what was going on in my body.
Amen.
Which seems to be a really common theme in chronically ill patients, that like if we've been blown off, like the first thing we do is like when we're old enough to make a choice, it's like, we're going to go work in healthcare. And then we're like, because we don't have enough trauma in our lives.
Right?
Okay. a
We'll get
weird
to
choice.
this, by the way. We're going to get to this because you, my friend, have helped people in this chat like you have no idea. And I want to talk about that later. But let's keep focused right now.
Yeah. So I've graduated. I've gotten my bachelor's in communication disorders with a minor in Spanish. Did my entire last semester of college while I was recovering from my second major knee surgery. Had my first major knee surgery at 17. Just had my third at 34. Like, it's been a whole thing. And I just remember when my orthopedic surgeon at 20, when I had my surgery at 24, was like, you're gonna have to take this semester off of college. I laughed at him and I was like, I graduate in May. Like, that's cute, but it's not happening. And so I just remember that, like, I don't really trust doctors at this point because I'm like, y'all can't decide what's up or down. You guys, nobody's really digging into what's going on with my body.
Right.
We keep running labs and then I keep getting shamed because my labs are abnormal, but we're not really trying to figure out why the labs are abnormal.
Right.
Other than, well, you just need to lose the weight. Thanks, Captain Obvious. Hadn't considered it before.
Right.
Hadn't crossed my mind.
So what are you doing at this point?
So I had asked him, I was like, what do I, like, if I need to lose weight, like, what do my macros need to be?
Mm-hmm.
And he was like, well, probably 1,200 calories a day. And I laughed. I was like, it is 2018. We cannot still be prescribing.
Right, the 1,200 calorie thing.
The 1,200, like, I was like, I know y'all don't take a whole lot of nutrition in med school, but surely we've come a little further.
Right.
And I was like, all right, I was like, if that's your recommendation, like, send me to a dietitian. Well, the university hospital here will only see you as in their dietetics program as a patient if you are type 2 diabetic. Well, I'm not type 2 diabetic yet. My A1C is fine. My A1C is hanging out at like 5.6. So we're like, well, and I remember my PCP being like, oh, well, with how long you've been overweight, like, that's really good. Like, that means your body's still working the way it should. As I'm looking at all these other, like, really red, like, out of range labs, I'm like,
yeah.
So my pancreas is working.
Right. Okay.
Not much else.
Right.
So I was still having issues with my cycles not being regular and all of that. And so he goes, well, let me send you to gynecology. He goes, I want you to see the gynecologist my wife sees. Mm-hmm. And I was like, weird referral start, but okay. He was like, no, she's fantastic. She's like very like upper leadership in the department. Like, she really knows her stuff. Loved my gynecologist. I go to see her for my woman's exam. And before I've left that appointment, just based on my symptoms and what she saw, like the way she said it was the way my hair was growing and the amount of facial hair I had. She goes, I'm 95% sure it's polycystic ovarian syndrome. Mm-hmm. I'm so sorry nobody like looked into this beforehand. She was like, let me get your labs back to confirm. Like, we need to get an ultrasound and do kind of this confirmation stuff. But she was like 95% sure it's that. Sure enough, it's polycystic ovarian syndrome.
What were you told about that?
Huh?
What were you told about that, by the way?
She said that she actually called me after hours and she got all of my lab results back and we talked for like 45 minutes and she was like, I think the best thing for you to do is to resume birth control because you do need to. I was going 3 to 4 months without having a cycle. She was like,
right,
you need to be having a more regular cycle. And she was like, and I think she's like, there's a couple of options. We could either do progesterone every 3 months or we can just put you on birth control. You'll have an induced cycle every 28 to 35 days. Like, you'll feel better. Mm-hmm. I wasn't a candidate for metformin because my A1C was fine. So they didn't want to put me on anything at that point. And then she was like, there's not really a whole lot we can do other than just kind of band-aiding the symptoms, which was fair. Like, I appreciated her honesty about it. Yeah. She was like, but I am really sorry that like you've likely been dealing with this since you were a teenager. And like, that's why everything has been so difficult for you metabolically. That's probably contributing to why your lipid panel looks so bad and all of this other stuff. She was like, yes, losing the weight will help control your symptoms. Losing the weight will help you feel better in your body. She was like, I don't know like what macros or anything you should be. She's like, that's not my forte. She was like,
Yeah.
I deliver babies all day long. That's a lot of math is involved in figuring out macros. She's like, we don't
Right.
get
Good for
along.
her though. Good. Yeah.
Yeah. And so she was like, there is a dietitian at TMC who will see, so TMC is the other big hospital system here, but she was like, they will see PCOS patients and kind of get you guys started and monitor you guys. And I was like, okay, great. So I went there. Come to find out, I wasn't seeing a dietitian. They were hiring nutritionists at that point because they were so overwhelmed with referrals and anything. So basically, if you were a warm body and could do math, they were putting you in as like a nutritionist.
Yeah.
Which, by the way, there's a stark difference between anybody can call themselves a nutritionist, but you have to have a master's degree and a lot of education to call yourself a dietitian. And she again goes, well, you should probably be eating 1,200 calories a day. And I was like, no, like just no, not doing it. And she was like, well, if you're not going to listen to my recommendations, I don't know why you're here. So then I had a friend who was very into like bodybuilding and like, so I texted her and I was like, hey, here's what's going on. Can you help me figure it out? And she was like, yeah. So she like ran my stats and like with her, the dietitian that was helping them with their bodybuilding stuff was just like, hey, like my friend's dealing with XYZ, yada, yada. Mm-hmm. And they gave me, so I was at like 1,600 calories, like 100, and this was really before like we knew that like if you ate more protein, you kind of felt better when you were calorie restricting.
Yeah.
So I did like 110 grams of protein a day, trying to get 25 to 30 grams of fiber in, yada, yada. Amidst all of this, I'm still having all of these orthostatic symptoms. I'm still having what I think is just like fibromyalgia pain, just like weird joint pain kind of widespread through my body. Mm-hmm. And then I finally get sent for a workup for autonomic dysfunction, which is a tilt table test, which is if you have never had the misfortune of having one of those, I'm so glad for you. I've had 3 of them in a year, and that was 3 too many. Basically what they do is they lay you flat, they strap you to the table, and then they bring you up to 90 degrees because they're trying to elicit symptoms in a controlled environment. So you're strapped into like a blood pressure cuff and you have all these EKG monitors on you because they're trying to figure out what's going on. Well, I had restarted propranolol for my heart rate control at this point. So my first one is like null and void because I'm not going to have the correct heart rate response if we're blunting my heart rate with a beta blocker.
Right.
And then, by the way, I'm like, everybody's like, well, you should get off all these meds because they're probably making your weight worse. You know what's making my weight worse? Existing. Like,
yeah.
So I go in for the second one, and the first one I had done was during COVID with this cardiologist who should have retired like 4 years before he retired. And he looked at me and he goes, well, some women are just dizzy when they stand up. And I was like, sure.
What's the deal? God.
I was like, can we, like, it's 2020 at this point. Can we please, like, this argument is so tired and tried.
Oh my God.
Like, can we please come up with something new and creative? So I do another one in 2021, and I have some weird heart rate things happen during it, but they're like, we're not really 100% sure if it's XYZ, whatever. So they started me on treatment for autonomic dysfunction, which was adding another med that didn't mess with my blood pressure, but controlled my heart rate better. So I had much tighter heart rate control, which made me feel better because when your heart rate's not all over the place, you tend to feel better. So I did that. I started treatment for that. I was talking to my cardiologist at the time and I was like, hey, I was like, I've also had a bunch of really weird joint dislocations. I've also had a bunch of really weird things. I was doing some digging, and I'm concerned that I have a connective tissue problem, very likely hypermobile Ehlers-Danlos syndrome or hypermobility spectrum disorder. Would you be willing to work me up for that? And she was like, yeah, of course. So we did the genetic testing to make sure that I didn't have any of the like big scary
Sure.
types of Ehlers-Danlos syndrome, like vascular, where like your aorta will just like give out and rupture with
Right.
that subtype, like pass.
Right.
So thankfully my genetic testing came back negative. So we went through the rest of the diagnostic criteria and it's like, it's like, so like one of the things is like, can you take your thumb and passively push it all the way to your wrist?
Right.
Yeah.
No.
Yeah. So that's normal. Like,
Right.
but like, I'm all the way. One of them is laying your pinky on a flat surface and like, can you bring it up to 90 degrees? And it's like,
You're like, ding, ding.
yeah. So I'm hitting points. Like it's called the Baton score. And I was 9 out of 9 on the Baton score. And then there's all this other criteria where it's like, do you have, I think one of them was like, do you have like extra, like stretchy skin? So if you pull the skin on the top of my hand, like it's very stretchy. I have extra skin on my face. That's kind of, it will get worse once I've lost more lbs, which is fine. Like that's just the way my body is.
Right.
And it's like, have you had joint dislocations or subluxations? And I'm like, hey, that's me.
And how old are you right now as you're figuring this out?
So this is summer of 2021. So I am 29.
Yeah.
So I go to tell my PCP, I am changing PCPs because the internal medicine residence is a 3-year program at all universities. So I go to see my new PCP and I'm like, hey, I think we figured out what's going on. And he's like, what's up? And I told him what I just got diagnosed with, and he puts his hand on my shoulder. He puts his hand on my leg and he goes, Anne Marie, he goes, that explains so much about so many things wrong with you. I was like, doesn't it though? And he was like, I am so sorry we all missed this and that nobody is taking you seriously and that you had to have cardiology work you up for that. But he was like, I'm really glad we have answers. He was like, because now we can start managing your pain. We can start getting you symptom relief, which will likely make you more motivated and have an easier time wanting to work out. And you won't feel as miserable if we can get your pain better controlled. So we made some med changes and started me on duloxetine for my chronic pain, which actually has made a huge difference both in my depression and my chronic pain. And then the next summer I saw him and was like, now that we've gotten everything figured out, like I really want to take losing weight seriously.
Yes.
And he looked at me, he was like, you've taken it seriously. He was like, we're just missing something. This is right about the time when Jaro is hitting the market, and he was like, there's a new medication. He was like, I want to get a lot more labs on you. He was like, I want to get a lipid panel, apolipoprotein B, just ran a bunch of different like labs that I needed. Hold on, I need to get up and turn on the fan. I am sweating. And so he runs these tests. Oh, because my thermostat is set to 70 degrees or 80 degrees.
Oh my God.
That's why I'm sweating. Oh boy.
Why is it at 80? But okay.
So he's running all of these tests and he's like, I think, I think we need to really consider some medical intervention for you. He's like, I don't think bariatric surgery is the answer, but I do think that doing something like medication, he's like, we could do phentermine. And I was like, no, because I just gotten diagnosed with ADHD. So I was already on Adderall. I was like, I'm not messing with like the whole stimulant thing. like that's going to be a non-starter.
What did you know about MJ at this time?
So it had literally just hit the market that summer. So this is October of 2022 when we're after he's gotten all these labs back, and he's like, what? He's like, there's this new GLP-1 that just hit the market. He was like, it's really promising in trials. It's called Mounjaro. You'll probably need a prior authorization for it. He was like, your insurance may or may not cover it. He was like, but let me submit for it and we'll kind of see what happens. My insurance wouldn't cover it because I'm not type 2 diabetic. However, I am now firmly in the pre-diabetic range. My A1C has come back for about 6 months, sitting at 5.96. So for like right at the beginnings of pre-diabetes. And I was like, my dad has diabetes. I was like, I'm not going down this road.
Right.
I don't care what we have to do. I'm not doing it.
Yeah.
So he submitted for Mounjaro. My insurance denied it. My insurance would cover Ozempic with no PA though. So he started me on Ozempic. I did about 8 weeks on Ozempic. I didn't love it. This is before this community was really a thing. Like we knew about pre-gaming, we knew about managing side effects and all of that. So I am taking my shot at 2 p.m. on a Sunday and then going to my in-laws' house for family dinner.
Yeah. I remember you saying that.
No wonder I don't feel good.
What did you have for dinner?
Well, my mother-in-law would make a full Sunday dinner. Like,
Of course.
Meat, potatoes, and a veg usually in some capacity. All things that are really kind of hard to eat on your first couple of days after GLP-1.
Yeah.
So Ozempic hit a short edge because this is now gaining traction on social media, and so everybody wants it. Well, Eli Lilly, in all of their infinite wisdom, had put out a $25 coupon for Mounjaro, even if you didn't have insurance coverage for it.
Woo woo.
So I said, okay. I switched to Mounjaro, used the coupon. Somehow was managed because you could fill every 21 days with the coupon. So I managed to build up enough to get me through 2023. Because then they started being like, they let the coupon go, I think, for about a year after it hit the market. So it expired like July of 2023.
Yeah.
I had enough to get me through the rest of the year on 2023.
How did you feel switching? What was the difference for you?
I felt a lot better on Mounjaro. I remember it was probably a week, 2 weeks after I switched. I just remember my brain being so quiet. So quiet. And I was like, whoa, this is weird. Like when I leave the house, I'm not thinking of all the different fast food restaurants I drive by and what can I get there and who has the best deals this week? You know what I mean? Like I'm not doing any of that. I'm not sitting in my car in a parking lot after I've gone through a drive-through eating and then like immediately throwing it away in like the parking lot trash can. I'm not doing any of that weird.
I feel like for most of us, that food noise relief from that has been life-changing for sure.
Yeah. And so I just remember I was like, wow. I was like, this is magical. Summer of 2023, I remember standing at my back door and a really bad storm was moving because we do get pretty good summer storms. And so I remember standing there and looking outside and watching this massive storm move in and going, my head doesn't feel like it's gonna explode. The only change we've made to anything at this point is adding in tirzepatide.
Now, isn't this interesting? So you're on your other medications, you're dealing with this chronic disease, and now you've taken tirzepatide, and this is something that you now feel, right, with just this medication alone. So what are you thinking at this time?
The first time I thought it was a fluke. I was like, okay, I was like, maybe my migraines are just like better. Like I'm finally, like I've been on everything long enough and I've reduced stress and yada, yada, that like we're finally better. And then, call me Sabrina on here. She has a neurological condition called idiopathic intracranial hypertension.
Mm-hmm.
And so she had made a video and she was like, hey, she was like, does anybody with migraines or like this condition, like, have you noticed the longer you've been on Manjaro, like the better your head has felt? And I was like, and so I mentioned it to my neurologist, and my neurologist was like, well, he was like, no. He was like, GLP-1s don't work in the brain like that. And I was like, and in his defense, like we didn't have all of this data coming out about how it did in 2023. Like that was a fair answer. Like we didn't think GLP-1s and GIP worked in the brain to the extent that it does.
Right.
Now that we've got 4 years of data on it and yada yada, we do know that like, yeah, it does help people with idiopathic intracranial hypertension. It does seem to be helping migraines. There's a couple of pilot studies out of Europe right now looking at the benefits of adding in tirzepatide for difficult to control migraines. Yeah. And I was like, I'm not crazy.
Yeah.
And I told my PCP, I remember seeing my PCP about it and telling him, and he was like, yeah, he was like, I've really seen in patients with multiple chronic illnesses that he was like, we don't quite know the mechanism of action, but we know that there's some, and this is like, they're still figuring out like all the anti-inflammatory benefits of GLP-1s at this point. And he was like, but we are seeing some reduction in their inflammatory pathways that seems to just be really making a difference. I got diagnosed with osteoarthritis in my left knee at 17. Manjaro and Zepbound have really helped that, have made that a lot more bearable even after having this third knee surgery in March. Like it's helped the inflammation and kind of helped that. I think it's really helped that recovery because I haven't been so inflamed and had all of those inflammatory histamine things floating around wreaking havoc on my in my body. So there's like, that's been a really big help. It's helped my chronic pain. It's really been life-changing. Like even if I don't lose another LB on it, I'll stay on it for the rest of my life just for all the other benefits.
Yeah. And I love that we're talking about that today with people with chronic illness and autoimmune and all the things that I know everybody in this chat can agree with you on that. I think it's important to talk about, I know you used to say, you're a slow responder when it comes to the loss, right, of the adipose tissue, but really how much this is helping you overall. So can you give some sort of insight or encouragement to those that may be in this chat that feel similar to you?
Yeah. This is not a quick fix. It is definitely a time and treatment, and kind of the more I've titrated my dose up, the better I've felt from an inflammation perspective. 10 milligrams really seems to be that spot. It did really take about 8 to 12 weeks for it to start kicking in my body, for me to start really noticing the food noise being gone consistently, the inflammation being lowered consistently, the satiety being more consistent. Don't chase the things you can't control. Like, I got on the scale, or I got on the thing on the floor on Sunday because I had an appointment with my dietitian Gianna this week and needed an updated number for her so we could make a decision about where we were going to go. And that was the first time I got on since surgery, aside from like having to get on at the ortho because my ortho will track just to make sure I'm not retaining fluid or anything, all of those weird things. The number on the thing on the floor is a lot less important than your overall health. And so for me to have the cardiac protection is huge because there's a huge family history of both of my parents have had open heart surgery before 70, which ups your risk for coronary artery disease like 50 to 60%. Both of my parents have struggled with their weight. So my obesity is very heavily genetics coded. My connective tissue disorder makes working out unreliable. Some days I can do it, and other days I don't. Like, it's really hard. My POTS also makes it difficult to work out because if my heart rate's really all over the place and kind of doing everything, that makes it hard to work out. Mm-hmm. The things I can control are what I put in my body, how hydrated I am, and being compliant with my treatment plan. Mm-hmm. And so if you're not taking... And so one thing that I'm really tired of hearing in this community is that, like, oh, this is just a tool to help you lose the lbs. No.
It's not a weight loss shot.
We don't talk about my blood thinner being a tool to keep my blood thin. We don't talk about my beta blocker just being a tool to control my POTS. Yeah. This is the only medication I've ever been on where the narrative around it has been, yeah, hey, it's just a tool. Like, don't get attached to it. It's just a tool. No, this is a treatment for chronic disease that is unrelenting, difficult to control, and that has given consistent results without the really gnarly side effects of things like Topamax or phentermine and all of those kinds of things. So I have really started pushing back. And it's the first treatment we've really had that really controls PCOS, PMOS symptoms in a way that is improving metabolic syndrome and all of the other associated risks with PCOS, PMOS.
Yeah.
So
absolutely.
I think to call it a tool is very diminutive and very much still making it a willpower issue. You can't out willpower metabolic dysfunction.
No.
No matter how much they tell you that it's a choice, that you've just chosen to sit on the couch and eat Twinkies all day, like, metabolic dysfunction starts in the brain. Starts with the way your brain is trying to regulate your appetite and your fullness signals and all of those things. Mm-hmm.
If there's someone in this chat right now that hears you but maybe doesn't believe that, I know you're talking about this now and you've said some things before, but what are you going to tell them from your experience? What do you say?
It is very freeing to have something that I only take once a week that controls so much wrong in my body, that controls the way my brain tries to regulate my appetite, that controls the metabolic syndrome from the polycystic ovarian, from the PCOS, PMOS, from the it's even helped my anxiety. Like, I'm not so anxious because I have space to, like, think through things and work through things. And I get it, like, the media has taken all of these adverse side effects from GLP-1s and really run with it and just absolutely turned it into a heyday. Mm-hmm. Almost every side effect I've had, I have self-induced because I didn't consume enough. I didn't drink enough water. I didn't move my body correctly. I didn't eat enough fiber, yada, yada. Mm-hmm. It's very, like, they're very manageable. The big scary things like gastroparesis and the non-arteritic, whatever, Nion and all of that. You're at higher risk for things like that with untreated obesity that progresses into type 2 diabetes.
Yeah.
And that type 2 diabetes is the end game for untreated obesity.
Talk
Because
about that.
eventually your pancreas just can't keep up with regulating your blood sugar anymore.
Yeah.
So I know that the media makes it sound big and scary, but I would really encourage you to sit down and have a conversation with it doesn't even have to be a physician, but with a medical provider, with a PA, with an NP, with a MDDO, like with somebody who knows what these meds are capable of. We know that PCPs aren't the best about this, but they do see enough diabetic patients. They do have enough patients on them that most of them have enough familiarity with it to at least start having the conversation with you about whether or not you're a candidate for it. And if they don't, then ask them if they know somebody who can.
Mm-hmm. Yeah.
Like expand your, like there's a really big, we're very quick online to be like, well, just fire that doctor. Well, okay. Well, we are in a massive primary care provider shortage in this country. So if you have one, don't throw them in the trash because you're not quite getting what you want.
Mm-hmm.
Like ask them if they're willing to, if they know somebody else in their practice who knows about these and is willing to have a conversation with them or you about it.
Yeah.
Most primary care practices, if they're affiliated with a hospital, have access to a clinical pharmacist. Ask them if you can make an appointment with them to sit down and they can go through the risks and benefits of that with you.
I love us talking about this right now because as we've talked, we've seen Anne-Marie be her own advocate from childhood, right? And so many of us feel like we don't have a say or we can't speak up for ourselves or any of that. So I think it's important, Anne-Marie, if someone was to say, oh God, please help me, Anne-Marie, what do I do? I need to talk to someone about this. I need to advocate for myself. Give us some guidance, just like you were saying, of different avenues or what to say or what to do.
So I think I have found that the best way to advocate for myself has been when there are just things that you hear that you just know aren't quite right. So when you hear one of those, respectfully challenge your doctor on them and be like, why? Like, I don't understand the correlation or the relationship between this. Can you explain it to me?
Many people just leave the appointment going, what was just talked about? I have to say something. Yeah.
Now, a lot of doctors will let you audio record your appointment so then you can go back and listen to it. I've done that when my brain fog has been really bad. Like, hey, I know we're going to go through a lot in this appointment. Do you mind if I record this so we kind of know? I had a doctor who knew a lot about GLP-1s when they were first gaining popularity and then was immediately told nothing as well. So I don't unfortunately, GLP-1s are not the only medication class that happens with. Mm-hmm. It's just, there's not, the healthcare system isn't built for doctors to spend enough time with their patients and give them the information they need.
Yeah.
That's why patient-centered communities like the GLP-1 space on TikTok are really helpful. I have my own gripes with the chronic illness spaces on social media. I feel like a lot of times it becomes the sickness Olympics, and I'm not here to play the Olympics.
Yeah.
Amanda, it's more of a system thing. They just don't when they're seeing 100 patients a day and everybody's booked for 15 minutes appointments.
It's hard.
They're not. Insurance doesn't prioritize patient-centered care. Practices don't make money if they're not billing an insane amount of insurance visits.
It's hard. That's why I'm fortunate to have that doctor that is a concierge. I spend an hour with him. I pay out of pocket, but it's so worth it. And he loves it. And they make those choices. A lot of times doctors, are held back because of that issue there. But I'm grateful to have that opportunity, but most people don't.
Yeah. I mean, we are forecasted. I think the last forecast I saw was by the mid 2030s, we are expected to not have enough primary care providers in the country for the aging for like the population.
Yeah.
And that should scare you.
Yeah.
Like, if we don't have enough primary care providers to take care of patients, specialist wait times, which are already out of this world, are going to probably double or triple because everybody's going to have to be managed by a specialist and can't just be trished back to their PCP for management once they get diagnosis and a treatment plan in place. Yeah. And my piece, like, I'm fortunate enough that my primary care provider books me in a 40-minute slot every 6 months, and I can go in and see him more if I need to. But in those 40 minutes, we go through so much.
Mm-hmm.
And so I'm thankful to have that with a PCP who is in a major healthcare system, because that's not the norm.
Yeah.
But I also know that like the standard is 15 to 20 minutes.
Yeah.
So I saw Jeff, and I think Eamon both bring up like preparing before the appointment.
Yeah.
Go in with a list of questions.
Yes.
Go prepared. If you have to write down your list, I had a notebook when I was getting worked up with POTS and EDS and everything, that it was like, all right, it was all of the things we've ruled out. I just had this running list of all of the things we've ruled out and all of the things that maybe I thought were worth investigating. And then there was a third column I had that was like what my PCP thought we were. Mm-hmm. And sometimes those lists meshed really well, and sometimes they were different. Mm-hmm. But it at least gave me the framework to have a conversation and go, I'm concerned about this. Why aren't you? Or you're concerned about this. Why are you? Like, what of my symptoms fits this to make you concerned about this?
Right. I love that.
And sometimes it was just like, I don't know, but we're going to just start ruling things out and see what comes back.
Yeah.
Critical. Which is fine. Like, yeah. I will always take, I don't know, but we're going to just kind of throw things at the wall and see what sticks.
Right. So I love that you are like that. And I hope people are listening today that can do something like that to help themselves out. Let's talk about the community really quick here on TikTok, the good side of it, right? All of us. How has this helped you? Hopefully people can resonate with this.
I saw Deb say that everything she's learned about GLP-1, she's learned off of TikTok. When I started on TikTok in 2022, listen, none of us knew what we were talking about. And I need you all to know that almost everything you hear from any content creator now in the GLP-1 space is all things we came up with in 2022, 2023 that are just being regurgitated because they work. Yeah. Things like making sure you're hydrated, making sure you're moving, nobody's reinventing the wheel in the GLP-1 content space. Unless you're Chris Sanford, I love his Be a Bitch Who Shits series where he goes grocery shopping. And it's like, look at all these high fiber things I bought. Like, I need fiber to have its moment because we've focused so heavily on protein that nobody's getting enough fiber. And colorectal cancer isn't cute, gang. Like, this community, I have made some of my best friends in this community. Like, the way everyone in the space rallied around me when I was having knee surgery in March to make sure that I had bills paid, I had what I needed for recovery, it was just phenomenal.
I love that.
I always say that this is the best corner of the internet. That said, there are some people in this community, which this happens in any community, that are trying to grift off of you, that are trying to create a scarcity mindset to get you to buy whatever supplement, latest and greatest thing they're trying to shill. Mm-hmm. There are people in this community that will fearmonger about things that are happening with compound or brand or whatever to try to get you to panic.
Yeah.
If you notice when things like that happen, a lot of us will talk about it, and you will hear kind of the same themes coming up when a lot of us are talking about it. And then you'll have the outliers that are creating the panic and the kind of outrage about it. Sagging skin seems to be having a resurgence. Like, I heard this all in 2023. Hi, you can't lose a significant amount of weight and not have loose skin. I don't care how you lose the weight.
Yeah. Yeah, so that's why it's important, right? To use your critical thinking, friends. Right?
So everybody's like, oh my God, you're gonna have loose skin. I'm like, oh my God, no kidding.
Right. So use your critical thinking for who you hear on here, what you see, the people that you spend time with on TikTok, right? There's the good side and there's not the great side. So stick with us. You know, Anne-Marie, I want to say thank you for being here. You know, you have helped really so many people here, and I want you to know that. If everyone give some love to Anne-Marie in the chat. You're a straight shooter, but you're a fighter, and you are here for people, and people appreciate you. So I want to bring someone up that you have helped this person so much, and I don't know if you realize it, but I want him to speak if he will.
Okay. Hi.
Hey, good morning. How are you?
Good morning. How are you? You're gonna make me cry.
Well, you just went through the list of things that you yelled at me in chats about when I first appeared on TikTok. You were like, that book's not written by a obesity board certified person. Please get Gianna's book instead. That do not believe the scare tactics, the scaremonger and all. But most importantly, just even on like talking about stacking diagnoses, with my cardiovascular stuff, like pretty much weekly, you just kept reminding me, you know, your LP little a score before an event. Most people find out afterwards. So you are fine. You will be fine. And that was incredibly helpful. So on top of everything else with the GLP-1s, that as well. Thank you so much.
You're welcome. I know it's easy to get caught up. Like, I get lost in the trees a lot in the forest when big scary things happen with my diagnoses. So I've always appreciated, usually it's my PCP who's like, I need you to take a breath and get off of Google before you work yourself into a tailspin. And I'm like, so I like, now that I know that about myself, I can usually recognize that in other people and be like, all right, you're going to drive yourself insane. Eat your oatmeal. You're going to be okay.
Yeah. It just shows the importance of this community, though, with Mush saying this, because, you aren't on here a lot anymore, Anne-Marie, which is fine. But Mush is, he's in different, we're in different spaces. And I'll tell you, probably every other day, Mush is like, thank God for Anne-Marie. Thank God for Anne-Marie. Thank God for Anne-Marie. And so it's just so important that we have this beautiful space here to uplift each other with the knowledge that you have, Anne-Marie, because, Mush is going through a lot. And for you to say, hey, listen, most people don't figure this out until after the cardiac arrest or whatever, really has helped him, really has kind of just calmed him down a little bit. And so he's so appreciative.
Yeah. And I mean, it blows my mind that cardiovascular disease is one of the things in this country that we're like, oh, well, we should probably do something about that before it becomes an issue, but we're just not going to do that. There is a huge shift in cardiology recently where they are doing more proactive things and looking for a coronary calcium scan to see how bad the plaque buildup is and yada, yada, yada. But like, I always tell people, healthcare practice is a good decade behind the research. So we have all of this research from the mid 2010s where we're like, hey, we could figure out what people's coronary artery severity is before they have an issue. But it took us about a decade to get caught up to doing that in practice. Like, healthcare is not quick to change and update and do things. So when you hear people talking about like, oh, my doctor did XYZ, it's usually because they're at an academic institution where they're on top of the research, where they're teaching residents about this in their residency programs.
Mhm.
So I'm always a huge proponent of, if you can go be seen at a university medical center, do that. Even if you just go for like a consult for a specialty, for like cardiology or something, they're generally at the top of their game, up to date on their latest recommendations, including prescribing GLP-1s after a major coronary artery event. Unless you're my mom's cardiologist, then you refuse, but that's...
Anything else you want to say, Mush? I wanted him to come on and just speak praises for you because he appreciates you. If you have anything else you want to say, Mush, please.
Yeah, well, the other thing I noticed early on was like when you were moderating in people's chats a lot, AJ has a minute to respond to a question. Jamie has a minute, like, he's just moving, and you're giving the next 2 or 3 important steps in whatever they're asking about. And I always found that so helpful, because even the questions would come up that I wouldn't even think of. And then I was like, okay, Jamie said this, AJ said this. Okay, what's Anne-Marie going to add to it? What's next? But also to be an advocate for yourself. You're a model of that. I'm the one that keeps telling them, like, yeah, I want a lipid panel, but I want the ApoB as well. Yeah, I want the complete metabolic panel, but I want the fasting insulin as well. Like, add all. I want to make all the ratios. I want to know what's going on here. And they're sort of shocked, like, when you do it, but they're willing to do it if you're pushing for it.
Yeah. And I hate that as patients we have to really know what we want or what we need. But I think there's a lot of value in respectfully challenging your doctor. Don't go in there and be an asshole and be like, my friend Anne-Marie said, I will absolutely disown you. I will absolutely disown you if I find out you're being an asshole to a medical provider. They are doing their best with the very limited resources they have. Be kind. But I found like a healthy challenge is generally where like the conversations of like, no, you know what? Maybe I'm not looking at this the right way, and we do need to kind of repivot and think about what we're working you up for. Or, hey, maybe we didn't run this lab correctly and we need to run these labs. But I've just found that after them, like, okay, why are you, like, what makes you think this? Is really opened the door to a lot of really healthy and productive conversations with my medical team. But don't go in there and go, my friend Anne-Marie has POTS and she said you're doing this wrong. I will not know you and I will throw you out the window immediately. I'll be like, nope, never seen them in my life. Who? Like, don't be that person. I did see Amanda asked about my, like, the gut-brain connection. I have anxiety, ADHD, and depression, and autonomic dysfunction. My gut-brain connection is all jacked up. I've done a lot of somatic therapy work and a lot of work in therapy to kind of repair that. But being on a GLP-1 has really given me the space and the brain capacity to do that work.
Yeah, I love it. Well, thank you for being up here, Anne-Marie.
Of course. I'm happy to be up here.
What is one fun non-scale victory for you?
Being able to be active with my niece and nephew. Like, my nephew's 5 and just started kindergarten, and the other day we were talking about school, and I was like, what's one thing you want school? I was like, what's one thing you want to happen this year while you're at school? And he goes, I want Auntie to come on a field trip with me. So, like, I'm getting all of my things get cleared through his school district so I can, like, go chaperone field trip, like a couple field trips with him. Like, my house is definitely his safe space. Like, last year when his little sister was born and his mom was in the hospital, he told everybody, he was like, this is my auntie, and I kind of sort of live at her house now. Which I thought was just the sweetest.
It's cute.
So just being really active in their life. Like, I'm my niece's primary caregiver during the week. Like, she spends 5 to 6 hours a day with me 4 days a week. So we're having so much fun. I've taught her what shake your booty means. So when she's watching Miss Rachel or we're just listening to music, like, I'll go, Maggie, shake your booty. And she'll just start stomping and shaking her butt. So,
it's so nice that you can be there healthy for her.
And so I love that I'm, like, my nephew's first choice of grown-ups that he wants to sit next to at dinner, or that he wants to come pick him up from, although this week, because my boyfriend's work schedule has changed and he's off, I've been chopped liver and he wants everything to do with my boyfriend and not me. That's fine.
That's okay.
Give it 2 weeks. Auntie will be his favorite person in the world again because Auntie prepares the snacks that she sends to car pickup line.
Yeah.
So this week he's wanted string cheese and apples. Although last night he told me string cheese and whatever, Auntie. So I was like, do you want the kitchen sponge? Do you want a dog toy? Like, what do you want? So I'm definitely going to put something silly in his lunchbox. In the lunchbox, I said with my boyfriend to pick him up from school.
That's so funny.
So
So one last question. If someone's going, I don't know about this treatment for this disease, I've heard about it, I don't know, what should I do? What would be your best advice to someone who's maybe nervous?
do it scared. I think there's a lot of value in doing it scared. One of my best friends that I've met on this app, her username is the one and only Jen too. We became friends because she saw my content and she talked herself out of starting on GLP-1 for an entire year.
Mm-hmm.
Because she made them, don't put GLP-1 side effects into your search bar on TikTok. Do not do it. Amen. Don't do it. Because you will get the, oh my God, you're gonna get gastroparesis and die side of TikTok.
Yeah.
Like, doing it scared, like, I can't think of any medication that I've been 100% confident in taking.
Right.
And especially a weekly, when my PCP was like, this is going to be a weekly injection. I was like, a what? You want me to poke myself once a week? And then I started on Repatha, and they're like, yeah, and then we're going to want you to do it twice a month with double the volume and higher viscosity. Good luck. Okay. I'm like, trust that your medical provider does have your best interests at heart, even if they're only spending 15 to 20 minutes with you. They have looked at your chart before they come in to see you. They know what's going on with your labs. They know kind of where they want your treatment to go. Like, we have sowed such distrust in medical providers and treatment plans and big pharma since COVID that I think we've really done a big disservice to the idea of a doctor-patient relationship. Like, your doctor's not prescribing a medication just because they think it's going to be fun and exciting for you. And if you're unsure about why they're wanting to initiate any type of medication for you, ask them. Because it's very likely that they think they've already talked about it with you, but they've just seen 15 patients that they've all started on blood pressure medication in the last 2 hours. Give them space to be human. They are not robots. They're not. If you're not sure, just be like, hey, can you remind me why we're doing this?
I love that. Any last comments, Mush?
Yeah, I was just going to say again, Emery, you're a model on that. I think that the psychological mechanism is that, like, when like a great amount of uncertainty faces a person, they want some sort of control, right? So when they have these different voices talking to them, these experts, and they're talking a language that they don't understand, or they don't get why, I think people shut down, just reject the experts, reject the science, and then their sense of control is like, well, I'm going to be my own boss, right? I'm going to take this, I'm going to drink this aloe juice or something, right? That's going to do it, as if pharmaceutical companies wouldn't be making billions off the aloe vera juice already if it worked, right? But you're a model for a person that's like, educate yourself, like, read up on things, right? That's how you take control. Like, you become a competent person in your conversations with your providers, and you treat them as partners in your own care. And I think that's what you kind of give off, a model for people, and I really appreciate that.
Yeah, of course.
Absolutely.
The other caveat I want to say is we are living in a time where our government doesn't believe in science either. Like, just please remember in 3rd grade when we all learned the scientific method, things like that exist for a reason. Like, science isn't scary. It's normal for science and things to change as we learn more about things. That doesn't mean we messed up. That doesn't mean we got it wrong. It's just normal to learn more and change opinions as things develop and change, and we get more information and more studies done on things.
Yeah, absolutely. Absolutely. Well, thank you so much.
You're welcome. Thank you.
I'm so glad that we could do this today.
Me
I'm going to put this
too.
on YouTube, if that's okay with you, Anne
Yeah,
Marie.
of course.
Everybody can go find that at AJ. Let's talk about it on YouTube. I'm going to put you guys down in the chat. Most of you want to put yourself down, and I'll put Anne Marie down.
Bye-bye.
Thank you for being here, Anne Marie. I appreciate you
Of course.
so much. I hope everybody follows Anne Marie. Double click here on her name. Make sure you follow her. She's a wealth of knowledge and so wonderful person in this community that is so helpful to everybody. So I appreciate you. I'm going to
I
put you
appreciate
down.
you. Okay.
All right. Bye. Isn't that great?